But I started going over there, and it really felt like I was just a chart. I don't know who anybody is. Nobody knows who I am. They just read, the sheet on my chart real quick before they come in the room. There's no follow-ups. It just felt like I wasn't getting any attention at all. I was left in the dark. There was no information being given. I wasn't getting any answers, even medications that were prescribed to me that I had bad reactions to. Nobody was held accountable for anything. I really didn't feel safe at all. Every time I went for an appointment, it felt like I was being treated like a medical condition. It feels, you feel helpless, very helpless. And even me, I do my research outside and I come prepared with questions, but when you do, you get like a kind of a pushback from the doctors. Like if you're somebody that's asking questions and that wants to, like, that's inquisitive and wants to know what's going on, like they expect you just to like move in and out. They'll just check you, do what they have to do. They don't tell you what they're doing, how you're measuring, anything. They measured my, to see the size of the baby, and I had no idea until I came here that I was actually measuring a little smaller than I should be. So I didn't know. There's no feedback, and if you ask, there's automatically like you feel like a wall coming down, and they get defensive. Like they don't want to explain. You feel helpless, and you don't feel safe. These cases happen across the board to every race, but it's pretty clear that it's a lot more frequent and prevalent amongst women of color to have to struggle like this. It's a bit disheartening because that's something that you can't necessarily control. And, I've experienced, being like that feeling of not being able to go to certain providers because of my social class, which has a lot to do with me being a woman of color. Well, I think, at this point, the American dream is pretty much a myth. I've seen so much hypocrisy and like double standards that, it's just in so many different facets of life. Like it really is something like just completely systemic, that we're just held back from so much knowledge, and there's so many things that lower classes being comprised of mainly people of color, that we're just never taught, are things that are passed down, like knowledge is passed down like as a family legacy pretty much, and we just don't get access to that.
The joy of it is my first time. I'm very excited. I can't wait till he comes. I'm very excited about that because, like you said, most people never had their first time. They never do it natural. So when I got pregnant, I was like, I'm just gonna have it natural. All the pain that I've been through in my life, I don't think this is gonna be any worse. I wanted a natural birth because, like I said, all the pain that I've been through in my life, I feel like, just taking this time out and they actually experiencing back in the old days how they used to do it. So I want to take my time out and just, take that time to actually go through a pregnancy without the epidural, without nothing. Just, I feel like that'll bring me closer to my baby. One of the fears that I've had after I found out I was pregnant was not being stable. That was really kind of hard, trying to find apartments, find where we're going to be at, took the time out to be in a shelter for a couple of months, and God has blessed us with a house, with our own room and everything. The second one is financial problems. Once you have a baby, it's not about you anymore. It's about them and giving your time and your affection, and also not having anybody to be there with me as well. So I thank God that I have somebody by my side, and not just somebody, somebody special, and that's the father of my baby, our baby. And now that we are stable and we are working, most pregnant women, they feel like they can't work, but you have to be determined. This is something that you want to do. What brings the emotion of how I feel most of the times when I speak about being pregnant or about life in general is because I done been through a lot of situations where people have not cared, and you put your heart into so many things and you show people that you're appreciative, and then like you're trying to be there for them, but it's like when you're stuck in that empty road, on an empty road, it's like you can't find nobody to help you. And I've had to learn, you can't put your whole heart into everybody, and you can't trust everybody. So my emotions are based on love and how I was raised. My mom used to always say, if they do wrong to you, still show them that you kill them with kindness. When the baby comes, I feel like it's just going to be me, him, and my husband. Because I'm already like that now. It's like when he goes to work, I miss him a lot. I feel lonely sometimes, even though he's at work. The emotions, they come and they go. Most people say you're just pregnant. No, sometimes it's not because you're just pregnant. Sometimes you really feel like that. And most people don't. They try not to understand, or they just don't understand, and they just don't get it. And he's kicking. He's like, yeah, Mom, you're right. So, I agree. The American dream and my American dream means to me taking responsibility for your own actions. You have a baby on the way. Maybe your first time, maybe a second time, maybe a third time. I feel like you should take responsibility of your own actions. And that's as far as in do what you have to do. Whether some people are judging you, whether they feel like this is not the best thing for you, you have to make your own life. Live your own life.
I think, and I tell you, from my experiences, African American women get treated different, totally different. When they go into these doctor's offices, when they go into the hospital, due to they may go in with the hair flying, meaning that the hair is not all there together, and because of that, these nurses judge them. They judge you according to the way you look, and they judge you according to how you speak, and if you don't ask any questions.
My experience at the doctor's office, I actually had to get referred out to another center versus the original center that I go to. It was a quite experience, and they checked me in, and it took a very long time for them to check me in. I went back at the desk and asked, is everything okay? They said, yes, we'll be calling you back in a second. As they called me back, the lady went over my chart. She went over the history and everything. She asked me certain questions, and she was concerned about why this doctor did this, why this doctor did that, and why I'm getting referred back over here, which I should have stayed with my other doctor. So actually, she went out the room and she talked to another nurse, and she was like, "Oh, that's another one of them with the gold card." And I kind of felt a little discomfort because it shouldn't matter of what type of insurance you have. Everyone should be treated the same way and with the same care.
Going back to the time when I first found out I was pregnant at the doctor's office, and the doctor came back in and told me that I was pregnant, but I was babysitting another infant. She came in after I had took the pregnancy test, and she came in and was like, "Well, that's your baby?" I was like, "No, I'm babysitting." She said, "Well, you're gonna be babysitting a lot more often because you're pregnant." And I just felt like that was disrespectful in a way, because she was, first of all, I already look younger than I already am. So I think she was I don't know if she paid attention to my chart or what, but I think she thought I was younger, and because I'm black and young.
Being in the field for over 30 years, a lot of my people that I work with, they say to me that when they go to the different doctor's offices, if they're not dressed a certain way, if they're not, I guess, educated the way they communicate, or they don't understand a lot of things, or if their literacy can't even read, that is a problem. A lot of times I notice that they may not know how to read. And if a person's staring at a paper a long time, I picked up through my years of experience, help them read those questions to them, ask them those questions without embarrassing them, because they're not going to just straight out say I can't read. When they go into the doctors, first of all, you're black, you're young, you don't, they assume you don't know anything, especially not coming in with questions or asking questions. They treat you like that. I think that is terrible. I think that we should just, give people an opportunity to express themselves regardless. And then you as a healthcare worker, we expect more out of them because we trust them. These are people that we trust.